Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time. Today we will discuss about CO6 denial code in medical billing. This denial code stating that procedure billed inconsistent with the patient age. Nothing but whenever the patient went to doctor will provide the services. After treatment was done by the doctor submit that medical claim information to the insurance in the form of medical claim forms. Then insurance will receive the claim and they process the claim. After that, they denied the claim stating CO6 denial code, and we can see this denial code on a denied EOBs. Whenever the denial code CO6, we have to understand that the reason why the insurance company not giving the payments to the doctor is procedure billed inconsistent with the patient's age. Nothing but doctor giving a service to the patient, but the whatever given services is not matched to the patient age. So that is what insurance, as per insurance guidelines, is insurance is not providing any payments to the doctor. At the time, what kind of pre-call analysis you should have to do as a AR caller before calling to insurance, what kind of analysis you will do on a medical claim, and what kind of questions you need to discuss over the phone call with the insurance representative as a AR caller, and also what kind of corrective actions, what kind of uh, uh, corrections you would like to make on this claim to get a payments from the insurance. Nothing but end action, what kind of end action you should have to take on this claim. If denied is there, what kind of actions you would like to take on the denial to make the denial into the payment. That steps I would like to discuss in this video. Before that guys, if you are watching our video first time, if you're not yet subscribed, kindly subscribe our channel PKR Vibes Career and Growth and hit the bell icon so that you will get every our video as a notifications to you. Okay guys, now we are discussing about pre-call analysis for CO6 denial in medical billing. Yeah, CO6 denial stating that procedure code inconsistent with the patient age. So the denial indicates that the procedure billed does not align with the patient medical history or diagnosis based on that respective patient age. So your insurance is telling that we are not providing any payments to you because the procedure and patient age is not appropriate. So in that case, what kind of pre-call analysis we should have to take, we will discuss now. Before that, we have to understand that for any denial in medical billing, if we are not getting any response from the payer, our job is to verify all available internal sources for the claim status. So what are the available sources? Nothing but doctor's internal software. It's also called as a billing software, or we can call it as a practice management system, PMS. And also we should have to verify our internal clearinghouse. So whatever clearinghouse we are using to submit electronic claims, so if you are submitting an electronic claim through clearinghouse, does we get any response regarding that particular claim or not? That kind of information we should have to verify in our clearinghouses. And also if you have access for that respective payer portal, then you have to verify the portal for the claim status. And if you doesn't found, then we used to call to insurance for the claim status. Simple. But if you are already denied EOB we received from the insurance, and already that EOB was posted in our billing software, nothing but in our practice management system software with the denial code CO6, then what kind of pre-call analysis you should have to take, we will discuss. At the time, you need to verify the previous date of service, procedure, billing history and payment history for the patient. See, we got a denial. Now our job is, denial is posted, then our job is to verify whether we got a payments for this kind of denial previously, right? Sometimes future date of service is also there. If we build the similar kind of services to the insurance, we got the payments or not, we should have to verify. For example, for the similar kind of services, we got a payments for the doctor, for the similar kind of patient, I mean for the same patient, similar kind of services, we got a payments. At the time, as a AR caller, you should have to verify before call, and with this information you have to call to information, I mean call to insurance, and you should have to probe this information over the phone call, that we are verified with reference to previous claim number. I got a payments from your insurance. Why this time claim was denied? Could you please reprocess the claim based on that reference of previous date of services claims? So in that way, you should have to request a call for reprocess. So there might be they will verify your information from their systems. If it is genuine, if they also found that yes, it was they given payment for the similar kind of services, definitely insurance representative will reprocess the claim over the phone call. So this is a really very good job. That is the importance of a pre-call analysis. So if you are finding this information as a pre-call analysis, I think your on-call steps also reduced. You are directly probing that information, you will reprocess the claim. That is the beauty of pre-call analysis for any denial in medical billing. So especially CO6 denial, we should have to verify the payment history for the previous DOS or future DOS. Okay guys, now we are discussing about AR caller on-call steps. As a AR caller, if you are calling to insurance representative for the claim status or for the denied claim status, what kind of questions you need to ask, we will discuss. These are the very basic and necessary questions you need to ask for CO6 denial. See, as we discussed previously, as a pre-call analysis, we verified, and let's suppose that we doesn't found any claim status from our internal sources. Then your first question is, hi, for example, I'm telling, hi, this is Thomas, I'm calling from provider's office checking on a claim status. So the basic question, it doesn't have any information with us for claim details. Then your basic question is, may I know the claim status please? So that is the basic question, right? At the time, insurance representative will provide that after verifying your date of service, billed amount, and provider details. They will tell that the claim is the claim status is so and so. So that is what, if you know EOB found or no claim status from found from our system, our basic question is, may I know the claim status please? And here the second case is, we already received a denial from the insurance, and the denial was posted with the CO6 CO06 denial code in our system. And at the time, what question you should have to ask to insurance representative is the point. Yeah, at the time you know denial, right? But you want to know the denial clarification more. At that time, you should have to ask like this: hi, this is Thomas, example, I'm pseudonym, example, my name is Thomas, that's why I'm telling Thomas. Okay, hi, this is Thomas calling from provider's office, may I know the denied clarification please? So insurance representative will understanding that based on this question, they thought that you know already aware about the denial, just you want clarification on your denial. So at the time, insurance representative will ask provider details, and then they will ask that what is the claim number, right? If then if you are providing claim number, they will provide the denied clarification for that denial. So I think they will tell that this denial is inconsistent with patient age. The diagnosis or procedure, whatever you build, procedure, whatever you build is inconsistent with the patient age. So that is the reason. At the time, you have to ask insurance representative. The next question is, may I know the which part of the documentation is inconsistent? So why this question I given is, they you have to analyze exactly, so which part of the documentation is inconsistent or missing. So mostly it is inconsistent. So either it is a diagnosis code or either it is a procedure code. And in our thing, mostly it is a procedure code, but sometimes also it is a diagnosis code. But this denial stands for procedure code inconsistent with patient age. But if you are deep go to the medical necessity, it might be also sometimes diagnosis code. So it is a better to clarify from our end as a AR caller which part of the documentation is inconsistent with the patient age. So at the time, mostly they will tell that this procedure code is inconsistent with the patient age. And at the time, if for example there are three procedure codes, then which procedure code are considered insufficient? For example, not always every time a single line is billed to claim, right? I mean insurance, right, on a claim. So there are a multiple CPTs also billed. Like example, we know very well that maximum 6 CPTs we bill to insurance on a claim form. For example, if you build three CPTs billed to insurance, and you don't know which procedure code is inconsistent for patient age. Coder will know that, but before that, you on call you should have to ask this question for the accurate things. So which procedure code are considered insufficient is the question. Then they will tell that the line item 2, for example, second procedure whatever you build on a claim form is inconsistent with the patient age. So that is what I provided this question. It should be very good question if you are asking and verifying this information on a call. And the next point I given, like uh, get the payer to reprocess the current denied claim based on the past payments for the similar services. So as a pre-call analysis, we discussed that we already got a payments for the same kind of denial, same kind of procedure for this patient on previous date of services or on future date of services. With reference to that claim, whatever we got a payments, we can probe that information, and we should request for reprocess the claim over the phone call itself. So at the time, insurance representative review that information from their end, and if it is a genuine or if they are agreed, they will reprocess the claim over the phone call itself. At the time, you should have to ask what is the reprocessing period. Mostly it is a 30 business days. So in that way, you should have to take a reference for that reprocess, and you should have to take that call reference number. You should have to close that claim, right? So that is what we should have to analyze the claims properly. So based on your pre-call analysis also, your claims will be reprocessed. So that is a very good job if you are reprocess the claim uh, over the phone call itself. And you should also for example, there is no previous payments, so at the time you should have to continue your questioning, like what is the mailing address and the timely filing limit for a corrected claims. So you should have to take this information. Why? Because if for example, uh, I will discuss in a end actions why it is corrected claims required. So but because if they are not we should have to task these claims to coding department. Why? Because if it is not procedure code, if you would like to change it, then after that we should have to change and we should have to submit the corrected claim. That's why corrected claim mailing address and timely filing is you should have to take this information over a phone call. And also you should have to take a mailing address and a timely filing limit for appeals also on the claim. This is also one basic basic question. And also last question is, can you please confirm the claim number and call reference number? See guys, for example, we already have a denial, no need to ask the claim number. For example, if you don't have any denied any claim status, so at the time you should have to verify the claim number over the phone call. It's very important. And also you should have to take the call reference number for this conversation whatever you append with the insurance representative. So in that way you can close this call based on this basic questions. These questions are very basic and vital for the CO6 denial. Okay guys, now we are discussing about end actions for CO6 denial in a medical billing. See, CO6 is nothing but patient inconsistent, patient age is inconsistent with the whatever we build procedure, right? So at the time, what kind of action you should have to take over the claim, final action. So here I given like first one is reprocess the claim. See guys, as we discussed in pre-call analysis, we got a payments for the uh, same similar kind of procedure. Why you denied this time? And on-call steps, we are verified this information. We got a payments. Could you please reprocess the claim? So in that situation, in that case, this scenario will go for reprocess. So why we reprocess means, if we got a payments for similar kind of services, we want payments this time also, right? At the time, why this time it was denied, we will probe this information, we will reprocess the claim. That is first scenario end action. This scenario, the end action, first end action is reprocess. Sometimes what happen, there is no previous payments. Okay, the first time it claim was denied, and on call we verified that denied clarification, and insurance representative stated that this whatever you build procedure is not consistent with the patient age whatever you are billed. So in this whatever you are given services, whatever it is, so in this case we are tasking this claim to coding, because the coder will determine exactly by seeing medical record. So they know very well, based on uh, medical necessity, they can change it also. If it is required, they will modify the procedure code, or they will modify the diagnosis code accordingly based on patient age. So that is what we, as a AR caller, it is a good job to task to coding assistance or coding review. Why? Because coder has a more knowledge compared to you on a service details. Service details are nothing but diagnosis code, CPT code, example for other place of services, or number of units. So authorizations, referrals, this kind of not authorization referrals, but the DX, CPT modifiers, and units, this kind of things are very pro. The coder is very pro compared to AR caller. So it is a better to task to coding review if procedure code is inconsistent with the patient age. You have to note this point. Mostly coding assistance is the end actions for this CO6 denial. And I given like last end action is like appeal to prove the medical necessity. So in when this will come into the picture, I would like to explain. See, there is a no previous payments, so there is a no reprocess, and also rep telling on deny, I mean on call, rep told that okay, this is procedure is inconsistent. Then as a AR caller, you are tasking these claims to coder assistance. After 15 business days or after 10 business days, then coder reviewed this claim, and coder stated that as per our coding review, whatever we coded at the earliest, at the prior, that is correct. So whatever we coding initially, that is correct. So there is no changes required as per medical necessity, as per medical records, and as per patient condition, as per our doctor treatment, whatever we build previously, whatever we coded previously, that is accurate. No modification required. So they again changing this coding bucket to AR denial standing. So again they are giving this claim backs to AR caller. Then what AR caller will do on this claim? So rep is telling that diagnosis code is inconsistent. We are tasking to coding. Coding is telling that coding is correct only. No modifications required. Then what AR caller will do? AR caller, if you are a good AR caller, you can call to insurance again, and you can prove that we are discussed with our internal coding system, and internal coder reviewed completed, and they are stating that whatever we build is correct only. Could you please reprocess the claim? They are telling that no, we already also, we are also standing the same. No, it is as per our insurance guidelines says, whatever we denied, that denial is a correct. And also internally our coder, whatever they coded, they are also correct. As a caller, your job is to appeal appeal the claim, that's it, simple. So everyone is correct, then your job is to appeal on the claim to get a payments, because we have a proof that our coder is telling this, and we have a medical record, right? Doctors given a service based on patient history and also patient diagnose. So that is what everything on a documentation, the medical history along with the doctor signature, that is called medical record. That records telling. as a proof. So that is why we have to appeal this claim to prove the medical necessity along with all supporting documents. So supporting documents is nothing but medical records or the related thing information. So patient related I mean age related information, service details, mostly medical records is the major proof to prove the medical necessity in this case. So at the time finally, that is what I'm taking. Before tasking to coding, we should have to verify the corrected claim information. That is why in on call steps I told that in if you are tasking to claims to coding, corrected claim, mailing address, corrected claim, TFL is very important. For example, coder is telling that yeah, okay, we are changing the diagnosis code, we are changing the procedure code according to patient age, then they are supposed to submit a corrected claims to the insurances. So at that time, corrected claim, timely filing, mailing address is very important. If you are doing appeal, also appeal address, appeal timely filing limit also very important. That is a key documentation, vital documentation. If you are doing appeal, that should be very important. So that's what the end action is, also appeal to prove the medical necessity. So guys, these are the basic end actions for a CO6 denial in our medical billing. Guys, if you felt content is useful, could you please like our video so that it will reach us many more needy people who are looking this kind of content. It will reach us them easily. And again, I'm telling thank you so much for your time. Have a good health. Bye for now.